Hello friends, welcome to Get My University in our session Sanvaad. Today I have with me a very special guest with me, Dr. Chi Villarate. Dr. Chi Villarate, she is the Vice Dean of College of Science and Arts at University of Perpetual Health System Dalta, Philippines. She is also chairing the program for international students at University of Perpetual Health System. She is an editor with Department of Education in Philippines. Also, she is the author with Rex Publication House and Anvil Publication House, Philippines. So, a learned professor, a learned dean, a thorough academician, editor, a writer, and the objective. Welcome, ma'am. Welcome to the session of Sanvaad.
Yes. Hi. Good afternoon to everyone that's watching this episode of Mr. Anuj.
Thank you, ma'am.
Thank you for the invite and the opportunity for me to represent the University of Perpetual Health System, Dalta, Philippines.
Thank you. Thank you. So, ma'am, the objective of taking this session is to give students, especially the medical students, a right clarity about the medical education system, process and pedagogy of the Philippines, and especially talking about University of Perpetual Health System, Dalta. There are so many students who actually get half-baked information from multiple information sources. Those are unverified sources, right? And students also don't have a clarity. They come with a half-minded approach, so that is where we want to know from you in this session. We want to really unravel what are the expectations and how is the program being designed. So let me start with my first question. In University of Perpetual Health System Dalta, you have students from so many countries. It's an international campus, right? How has been your experience with Indian students per se? So if you can elaborate on that and you can share your experience with the Indian students.
Okay, so I have joined the university 2017, and since then I was assigned as the Vice Dean of the University of Perpetual Health Philippines, and also assigned the program chair for international students, particularly AB-Phychology program. Now, basically the AB-Phychology program for the Indian students have been going on for like 10 years or more than 15 years already. Okay. So basically the university of choice usually for Indian students would be University of Perpetual Health. So I'm just going to tell that the University of Perpetual has been the second home to thousands of Indian students. So any foreign student, or especially Indian students, will never be indifferent, because once they walk through the campus, once they practice their medicine in the hospital of the University of Perpetual Health, all they will always see would be left and right. There will be, their comrades, their fellow countrymen that are lingering and are students, legitimate students of the university. Now, just to give you a background of the University of Perpetual Health and this seemingly customized medicine program that we give for the Indian students, is due to the fact that the University of Perpetual Health, aside from it having 45 years of service in the education, has already been awarded or recognized as an autonomous university status by the Commission of Higher Education here in the Philippines. So only a few universities, maybe around 60 universities all over the Philippines, are granted of this status. So what is the benefit when you belong to a university that already has an autonomous university status? It means that aside from all the standards, international and local standards, have been abided by the university that has autonomous status already can redesign the curriculum according to the needs of the clients. So with this, we started trying to redesign the curriculum for the Indian students. Specifically, on the next year, when I was a program chair, we introduced a tri-semester schedule.
Oh.
Okay, so the AB-Psychology program in the University of Perpetual Health is the only program that runs in tri-semester schedule.
Oh.
Now, all the other programs inside the university runs in semester schedule. Now, what is the benefit? Now, in a semester schedule, you usually try to consume like five months, okay, in order for you to finish one term. Okay, now in a tri-semester schedule, that schedule is cut in half. So basically, the student in one term will just going to spend like 2.5 months or 12 weeks in one term. Okay, so what is the connection of that? Why is it customized? Why is it a tri-semester schedule? In order to hasten or make more quick their transfer to the College of Medicine. Okay, now with this kind of design that we give to the Indian students, basically is one of the best opportunities that any foreign student would have. That instead of spending 5 months in one term, they get to just have 12 weeks of count, and they get to finish already one term.
Beautifully explained, ma'am. So very important thing, like we have a AB Psychology program, right? And a lot of students, they really want to know from you how this AB Psychology program is acting as a foundation program for the students. What are the learnings and the subjects that we are covering in the AB Psychology program, and how the learning and the overall, I'll say the psychological learning will help the students in the forthcoming area while they are pursuing their medicine education.
Yeah, thank you for that, Anuj. A lot of students actually are questioning me regarding that. Why not BS Medical Technology? Why not biology? Why not any kind of science-related course as a pre-medical course for the Indian students, for the foreign students? Now, I believe that when they transfer to the College of Medicine, they will be full of science subjects already.
Okay.
They will be fully loaded of all the exposures that they need in the science area. Now, the University of Perpetual wanted all the graduates are not only capable academically, hence they are nurtured holistically.
Okay.
So we look more into their character. We look more on how they relate to other people. Now, the best program is AB Psychology. Well, any kind of course will be always good as a baseline for medicine, but the benefit of you studying AB Psychology is you get to be exposed on how the human behavior works.
Yes.
On how the mind is capable of doing things for the whole system of a person. Now, also, I believe that being a future doctor, you're not just there to give diagnosis. You're not just there to give the medication. You're not just there to explain the procedure or the surgery that a patient must do. You are first a human being listening to the symptoms of a certain person. That it is very important to build a rapport between a doctor and the patient in order for the doctor to really know and exact the symptoms that the person is feeling within himself. So I believe that with the students getting to be exposed on how the human brain works, on how human beings behave this way, we will give them the best of both worlds, that they will not just be a doctor that is capable of giving diagnosis and medications. They will be doctors that actually heals, that actually understands people, that actually adjust themselves to other kinds of people. So this is the best of thing, my justification in all of the parents that I've been dealing with and answering, Dr. Chi, why AB Psychology? Why not another science-related course? So I'm always telling them, your children will always be exposed in millions of science things when they go to medicine. So why not give them another best of a world that engages them to deal with human behavior. Anyway, they're going to be doctors not just for the sickness or illnesses, they're going to be the doctors for society. And I believe that in order for them to be a good doctor, they have to be a good person first.
Very right, very right. I appreciate this particular word. In order to be a good doctor, first they have to be a good human being first. And adding to your point,
Yes.
I was just thinking lately, medicine is a special field which is a combination of arts, it's a combination of science, and it's a combination of humanities. Science in
Yes.
form of obviously anatomy and the fundamental specification and the fundamental learning of medicine science. Art in form of specializing and thinking creatively how you can, set the bars high and you can, really stress yourself to a next level. And humanities in form of really be humane, really being compassionate with the people, because, with every respect, with all the topmost doctors of the world, I was just watching through this series of Netflix. I was seeing the topmost four doctors of the world and see the kind of humility these four people possesses, right? And I think that is a basic thing. Anyone, if you're planning to, and that's what I also tell my students, if you're planning to be a doctor, first be passionate and second be humble and humiliate. Have a quality
Yeah.
of being humbleness, right?
Yeah. And in addition to that, Anuj, because the University of Perpetual Health is family owned, this
Yeah.
is owned by the Tamayo family.
Yeah.
So how we relate to our clients, how we relate as an organization is basically family oriented. So this comes from the legacy of the father, Dr. Tony Tamayo, Antonio Tamayo, passed on to the wife, which is Dr. Daisy Tamayo, and passed on now to the sons, Dr. Anthony M. Tamayo and Lieutenant Colonel Richard Tamayo. So how we relate to each other is a family. And what I saw as a culture in India, the strength of the culture of India is about family. It's how you love each other as a family. So I guess that's another strong point why there's a lot of Indian students enrolling in the University of Perpetual Health, because they feel that they are at home.
Yes.
They feel that they found a second home in our university.
So I was talking to a couple of students who have really great scores in their NMAT. They have 90 plus scores. And I was just wondering, I said, yeah, you have an option. You could have gone to the state universities in Philippines. But the simple thing is, they saying, sir, we never feel like leaving Perpetual, right? So we have a wonderful connect with our respective faculty members. Though we have chances and we are
Yes.
quite hopeful also we could have gone to some state universities. But we never feel like
Yes.
any vacuum or any iota of any problem in this, in the whole experience that we've experienced so far. Great. So, ma'am, this brings me to my another question, which is more related with the curriculum part. Uh, you being the program coordinator, what are your priorities? How really do you think to make your program more interactive? What are the steps that you feel are being taken by you or your team or the college administration to make the learning more innovative and to make it, fun and interactive? So I would like to know from you how University of Perpetual is really working on that part, making learning more interactive.
Yeah, at this during this year, this academic year 2020-2021, it's sort of a very different landscape right now for us, because all of my children are back there in India, and they are learning all of the AB-Psychology subjects through online. So even at the height of the pandemic during May 2020, I already suggested to the management that the Indian program can forgo the online classes, since all of them, the generation right now are 24/7 online. So I guess I told them they can survive online classes. Now, with regards to the interaction, with regards to the faculty members that I have in the AB Psychology department, well, I can be proud that all of them are professional and are the expert in their fields, because some of them are licensed psychologists with clinics outside of the university. They practice as licensed psychologists, so that they bring that to the university and have the students exposed to real scenarios of patients. So with this kind of scenario, having to have an external school, an external clinic that real patients are there, and having them as the situationary incidents of all the classes, I believe that's a realistic point of view. It's not any more theories. Hence, it's a practical application of what is being taught just in the book. So it's a balance between theories and practical applications in real life. Now, what is missing in the academic year of 2020-2021 is the balance of not extracurricular, like sports, like events, like in 2019, the batch of 2019 really got exposed to the Philippine culture. I really asked them to join my local students in all of the events. And here in the University of Perpetual Health, all of the events in India are being celebrated.
Great.
Just last week, we have co-celebrated with them, with all of you, the Pongal Festival. So we didn't have classes from January 14, 15, and 16 in order to co-celebrate your culture with our culture. So that's basically it. And come January 26th, the council officers that I have designed or made as a team is creating another event. Well, rather online. I don't know how will we make everything happy online with the celebration of your public day. So it's always, always a balance. I try as the Vice Dean and as the program chair of the AB-Phychology, always try to balance them being capable in academics and them also being capable to be socially aware of what's happening around them. So they get to have a chance to adjust themselves to different people. They're not just there to study within the Indian community, but I ask them to always join the local students. So they get to have chances to learn something more aside from the Indian culture. So it's always a balance. The 2019 batch can be the evidences of that, because I believe they have like 5 events that they danced your dances in front of the Filipinos of the university.
So no, I would like to invite you as a special guest to our country, right? And really get you the flavor.
I've been there last year.
You've been there last year, right?
I have visited India already last year.
Yes.
So when I enjoyed everything about India. I did not feel any different. As what I mentioned to you earlier, Anush, the core of the culture of both our cultures is family. Yes. And I saw that. And I didn't really feel indifferent when I went to India. I especially loved your people, how they embraced visitors. That whenever I visit an office there, I am always full of garlands. And I cannot carry anymore the many bouquets that were offered whenever I walk in the door. So that's how we also welcome visitors here in the Philippines. That's how warm and accepting our cultures are. So and again, another thing that I loved about their culture is your food.
Oh, Golgappas?
I cannot ever forget all of the foods that I've ate there, and during the 10 days that I visited India, I got really fat because of the many biryani that I get to eat.
I mean, it's wonderful, ma'am. It's been so rejuvenating. Now this gets me to the last part of our conversation. Like we have been discussing about how university is trying to do or innovate or to do or to take some steps forward to take students forward. Over here, I believe there's a lot of responsibility of the students also, and there's a expectation also as a college, as a mentors you have from the students who are coming to Philippines. So, from your perspective as the program mentor, what is expected out of a student, whereby there should not be any expectation gap?
Okay, the expectations from the student is just to make themselves good academically. The academically good means to always comply with all the academic requirements that the professors ask of them, to be participative in, well, because this is an online class, so you have to really always be participative, or else since the physicality, or you are not really seen in person by the professor, some of the students might not be really known by all of the professors, and hence we're just looking at the screen and it's flat, it's 2D, two dimension. So the interaction is lessened. However, I still am proud of the faculty members of the College of Arts and Sciences, because since May 2020, they have been delivering awesome and interactive classes to the foreign students, to the Indian students. Now, just comply with all the academic requirements, become participative in all of the classes that is given to them, and pass all of the exams, the major exams. There are 2 major exams in a term. So just that, and balance it with good behavior, right conduct, and proper decorum with the regards to conferring with the professor. That is basically the sum of an entire academic life in the University of Perpetual Health. So we're not just here to just give you grades. We're here to also make sure that you'll be a good citizen when you go back to India.
Great, ma'am, great.
Yeah.
So thanks a lot, ma'am. Thanks a lot, Dr. Chi, for sharing your experiences. And I am feeling it's like a very, very personal kind of a discussion, and so much to learn, so much to really explore, and definitely I am looking forward to have a meeting with you in my next visit to your campus. And I'm sure the experiences, the things which are coming from your heart will definitely enlighten a lot of students. They'll get a right perspective, they'll get a right clarity, and certainly a right vision and mission to pursue this beautiful profession of medicine in your respective college. Thank you, ma'am, for being a enlightenment to us.
Thank you very much.
Thank you, ma'am. Thanks a lot.
And thank you, Anuj, also.
Thank you, ma'am.
Anuj.
Thank you.
Okay.
Stay safe.
Goodbye.
Stay safe.
Stay safe also. Thank you.
Bye-bye.
Say hello to GMU, the one-stop shop for all your admission needs. We introduce you to the finest universities and help find the best fit based on your profile. We help with applications and assist with documentation, visas, and even accommodation. With over a decade's worth of experience, 40 university partners in 10 countries worldwide, and more than 5,000 satisfied students, GMU does it all. Fix a meeting with us today.